The belief that patients deserve access to mental health care in real time is what drives Emerald Psychiatry and TMS Center. They're responding to an ever-growing demand for care across the mental health spectrum. So to share exactly how they are helping patients, I'm happy to welcome Rachel McCarley and Stephen Hunt in this sponsored segment. So good to have you both with me.
It's great to be here.
All right, Rachel, you're the clinical director, so I want to turn to you first. I want you to share with us really the mission of Emerald Psychiatry. What is it that you hope for your patients?
Yes, so at Emerald we believe that people deserve access to mental health care when they need it and how they need it. And so what we have been doing is we went from earlier this year about 6 providers to over 20 now to allow for greater access to care. So our medication management appointment, we can now get people in the next day. And how they get it is through telehealth, which allows people to be in the comfort of their own home or own space. And we found that really successful for people.
Yeah, absolutely. And really that is it. That next day is almost unheard of these days, and people need help when they need it. I'm sure that's what you found.
Yes, absolutely.
All right, so seeing the possibilities include an aggressive growth strategy. How has that impacted your staffing as far as, you know, have you just had to kind of go find the best of the best and bring them to Columbus?
Yes.
Essentially, yes.
Yeah.
Yes, that's exactly what we've done there, because not only do we focus on the patient care, but we also want to make sure that the provider care is also balanced as well, so that we can give our best to them. And so we have an aggressive strategy there where we hire in all different sectors of the healthcare system here, from medical providers to more therapists to more admin staff who help take care and free up time for us to provide the care that patients need.
Absolutely. And Rachel, you mentioned the telehealth.
Yes.
How else are you providing services? Can people still do inpatient? How is kind of the ratio there of the care?
Yeah, so a couple of our services, so our TMS treatment is done in person. We have a couple of providers who will offer some in-person sessions for people if they need those. So we do try to meet the patient where they are and provide the care that they need individually.
And telehealth, really, I mean, you know, obviously during the pandemic became the sole source, but a lot of people have found it to be a preferred way of dealing, have they not?
We do find that most of our patients prefer that option, not having to drive in to the appointment, drive out. So we've really found that it's been a nice way to deliver services.
Absolutely. And Stephen, obviously any healthcare services, insurance plays a big part of that. So how do you help in that process when somebody's navigating that?
Of course, and especially nowadays here, insurance costs are quite high. And so oftentimes in psychiatry, or sometimes in other specialties there, it is a cash for payment service. But at Emerald, to kind of go back into our idea and our fundamental goal of providing quality evidence-based care to everyone when and how they need it, we accept most insurances, including Medicaid and Medicare, to ensure that if you call us, we can get you in quite soon without that cost barrier in the way.
And I imagine many people don't even know what their policy covers, don't even realize, right? So you can help kind of look into that.
All you got to do is just give us a call. We have a whole team of individuals, intake specialists, who will take care of looking at your insurance, determining potential costs and all that, just to make sure you're aware quite up front.
Okay, that's the best way to be.
Yes.
Rachel, you mentioned your TMS treatment. Some people watching may not even realize what that is. So give us a little rundown.
Sure. It's transcranial magnetic stimulation, and it's an FDA approved treatment for treatment-resistant depression. So that means for people who have tried some medications and therapy and unfortunately just not had the benefits of that we would have hoped to have seen. And what we find with it is about 70% of people experience a drastic reduction of symptoms or full remission of those symptoms of depression.
Does it always have to be the person who is experiencing this reaching out? Sometimes do you guys get loved ones calling and saying, you're both nodding in unison, right? Do you get people reaching out saying, you know, I don't even know how to approach, or how is the best way to kind of handle this situation?
Of course, and it's very much a collaborative kind of care model too, especially in psychiatry, because that often does occur. And so if an individual is struggling, first off, we always want to fundamentally say, whether you think it's big, whether you think it's small, it's important that it's bothering you. So give us a call for that, and we can help in any way possible there. But if a family member sees that and the individual is not quite at that kind of realization level there, they can still give us a call. We can still offer resources and services and connections for them to have, just in case at the point they do want to reach out or want to supply some information for their loved ones. We will give them all of that there by them just giving the office a call and setting them up.
Yeah, and it's great to know that you guys just have their back, right? That somebody is there to support them in that time. So emeraldpsychiatry.com, the 614 number also up there as well. So reach out. You heard them. They're there waiting for your call. So thank you both for being here.
Thank you so much.
Thank you.